So let's step away from politics and the news, which will probably relieve some of our listeners, and get sort of into the mechanics of how Social Security and Medicare work. So these are separate programs, right?
They are. Although we tend to talk about them at the same time, they are separate government programs. Social Security, that's the monthly cash income that a retiree receives in retirement to help support them and their lifestyle and their spending in retirement. This is based on the earnings record over time and is a cash payment that they get every month. Medicare covers health care. There's 4 parts to Medicare. You may have heard of them: A, B, C, D. Part A is hospital insurance. This covers, inpatient in the hospital, skilled nursing care, and some home health care. Typically, if you've worked at least 10 years, you're going to not have to pay any premiums for Part A. Part B is the one that most people are familiar with. This is the medical insurance. So this is covering doctor's visits, medical equipment, certain preventative care. And you're generally going to pay a premium based on your gross income for the prior year on your tax return. So it's a progressive premium system where they go up the more money you make. Part C is Medicare Advantage, where you can get a private company to cover you for A and B, and then also provide insurance for what Medicare doesn't provide. And we'll come back to that in a second. And then finally, Part D is the prescription drug coverage, and that also has a premium.
With Part C Medicare Advantage, that's in lieu of A and B, right? It sounds like you don't have them both at the same time.
Yeah, what you can do is you can either go directly through Medicare, and what I recommend typically to clients is to do Part A, B, and D, so the hospital, the medical, and the prescriptions. Skip Part C, and you can also go out to the private marketplace and get what's called a Medigap policy. A Medigap policy covers the generally the medical insurance covers 80% of care. So that other 20%, you're on the hook for. And that could be very substantial if you have a major surgery or other, major health crisis. 20% of that amount billed by the doctors and hospitals and could end up being a very significant amount of money. So you can buy health insurance for the piece that the Medicare isn't providing for. So that's called Medigap. There are a lot of private companies, and you probably see them a lot on news channels advertising their products. There's many, many different versions of this, but Medicare Advantage rolls up A, B, and basically the Medigap to run the program through one insurer. A lot of people like that convenience because, you're dealing with one company.